Hello and welcome to the 12 cranial nerves neuro assessment. Cranial nerve number 1, the olfactory nerve. We get the patient to occlude each nostril with their finger and sniff in, note any lack of smells or strange tastes during this process. Cranial nerve number 2, the optic nerve. Pupils must be pearler, pupils equal and reactive to round to light and accommodate. Place your hand in between the eyes of the patient to see if either eye reacts when shining the pen torch. A slight delay can be normal. Don't forget to test for accommodation by getting the patient to look ahead and make the pen closer to the nose. Also test the patient's peripheral vision. Cranial nerve number 3, 4 and 6, oculomotor, trochlea and abducens. We cover these three together as we test the eyes. We use a pen torch and we get the patient to keep their head still, and we move the pen torch mimicking the letter H with the patient looking straight ahead, only moving their eyes to follow the pen torch as it goes inferior oblique, superior oblique, medial rectus, superior rectus, lateral rectus and inferior rectus. No any tremors or drooping of the eyelids. Cranial nerve number 5, trigeminal. Patient closes eyes and use medium pressure to touch and stroke the patient's forehead, cheeks and mouth. You then repeat the process using a lighter touch. Note any reduced feeling on either side or sensation. Also get the patient to close their eyes and you put 2 fingers on either side of the mandible. Patient then clenches their jaw and you repeat at the front of the jaw. Cranial nerve number 7, facial nerve. The patient needs to raise both eyebrows, close their eyes and you open them, but the patient needs to resist. Get him to smile showing the top teeth, then the bottom teeth, and then get the patient to puff out their cheeks, resembling a blowfish. You then lightly press on the cheeks to check for resistance. Note any unsymmetrical differences. Cranial nerve number 8, vestibulocochlear or acoustic. Patient closes their eyes and you stand behind them and you whisper a word or a number different in each ear, and then get the patient to repeat back to you. Cranial nerve number 9, glossopharyngeal. Look in the patient's mouth and get them to open it and say ah, where you can then use a pen torch and check the location of the uvula. Note any deviation to one side as it can indicate stroke, tumour or history of tonsillitis or respiratory and airway problems. Cranial nerve number 12, hypoglossal. Get the patient to open their mouth and get them to stick out their tongue and then move it side to side. Note any atrophy or fasciculitis. Cranial nerve 10, 11, vagus and accessory. Put your hands on patient's shoulders and get them to sway both shoulders. Then place one hand on patient's head and get them to move their head against your hand.